Hello, in this video, we're going to discuss changes in brain activity that we see with bipolar disorder and the drugs that are commonly used to treat bipolar disorder. You went over the symptoms and the difference between mania and hypomania in the previous videos that were posted. This figure is trying to demonstrate to you the differences in brain activity in depressive and manic states. So here on May 17th, the patient's depressed, and if we remember back to previous chapters, when we're looking at a PET scan or an MRI, when we see reds and oranges, that means there's lots of brain activity. And when we see blues and greens, it means there's less activity. And you can see here, the brain is very inactive in the depressive state. There's not a lot of brain activity going on, at least at these different levels that are shown. Here on May 18th, when the individual was in a hypomanic, so not quite a manic state, but a hypomanic state that you learned about in the previous video, you can see there's a lot more brain activity going on. And then here on May 27th, when the patient again is in a depressed state, brain activity is low. So overall, there's an increase in glucose utilization, which means an increase in brain activity during periods of mania, and decreases of glucose utilization and thus decreases in brain activity during depressive states. And now just to discuss a few treatments. This is going to be a very short list of treatments. There are many others out there, but we don't have the time to go through them all. So the most common treatment is still lithium. And lithium is a salt that's known to stabilize mood and prevent relapses for mania and depression. Others that are known as mood stabilizers, or even more so as like an anticonvulsant or an anti-epileptic type of medication, are valproate. And I can't say this one, so I'm going to go with Tegretol. And basically the idea is that they seem to have some things in common. And so there are some newer drugs out there that aren't necessarily anticonvulsants or anti-epileptics that are used as well. But I want to talk about what these ones seem to have in common. And this might be a little controversial. So this is what our text discusses. If you look other places, there's some other suggestions as well. So the common mechanism for these is a decrease in AMPA receptor expression. Other places you look at that it decreases sodium channels or something like that. So, which I think is kind of the same idea. A decrease in AMPA receptor would decrease the areas through which sodium could go into the neuron. And overall, that decreases glutamate activity. I've also seen some other places where it talks about how they have an effect on GABA receptors. Another thing that they may have in common is that they block the synthesis of something called arachidonic acid. Now, this isn't something that we've talked about, but arachidonic acid is something that's produced during brain inflammation. So again, coming back to the idea that in some of these disorders, the brain seems to have this inflammatory response, and that perhaps if we can dampen that inflammatory response, we can get rid of the symptoms associated with the disorder. Now again, I said we weren't going to have the time to talk about other drugs, but antipsychotics are sometimes used to treat bipolar disorder, and antidepressants help stabilize the mood swings. So there are a lot of different drugs that are used to treat bipolar disorder.